I feel as though we're at an inflection point, and what we're poised to do, both in the context of serving our members, but also in the context of shaping health policy, is potentially really quite extraordinary. I feel as though we're just, it's kind of funny to think about this, but after, nearly 30 years, I feel as though we're really starting to hit our stride, and we're in a position to say, okay, you know us as this association that's been curating wonderful science, and we're going to keep doing that. But now we're taking that science and we're bringing that with very clear intention to policymakers worldwide, because we actually want that science to better inform health policy.
This is Associations Thrive, the podcast celebrating successful associations and their leaders. I'm your host, Joanna Pineda, CEO and Chief Troublemaker at Matrix Group International. Listen in as top association executives tell all, revealing the creative and innovative ways they're increasing membership, generating revenue, nurturing engagement, and reimagining their organizations. By the way, if you've launched a new initiative, created new member services, or updated your governance structure and are seeing great results, I want to hear your story, and so do my listeners. I'd love to have you as a guest. Go to podcast.matrixgroup.net and apply to be on Associations Thrive. Now let's dive into this week's show. Today, I'm speaking with Rob Abbott, CEO of ISPOR. Rob, welcome to the show.
Joanna, it's such a pleasure to join you today, and I really look forward to our conversation.
Me too. Well, let's start off by you telling us about ISPOR.
ISPOR is the Professional Society for Health Economics and Outcomes Research. We're headquartered in New Jersey in the United States, but we're a truly global professional society. We enjoy somewhere on the order of 20,000 members and chapters across over 100 countries around the world. And our purpose is to advance the profession of health economics and outcomes research, and crucially, use health economics and outcomes research to transform healthcare and health decision-making around the world.
Rob, who are your members? Are they doctors? Are they administrators? Are they researchers? Who are they?
One of the things that I believe makes ISPOR very, very special is that we are a big tent. And crucially, we're a multi-stakeholder society. And so we enjoy clinicians, so doctors and other clinicians among our members, but we have academics, we have researchers, we have ministers of health and government officials. We have consulting organizations. We have this very interesting mix of members who are united in their desire to improve health and healthcare decision-making.
Well, that's interesting. So, I work with other organizations where they're trying to improve health outcomes through research and better clinical practice. But your vision or your mission is really devoted to health economics outcomes research. So maybe you can define that for us.
Yeah, I'd be happy to, because I want to, in some respects, demystify health economics and outcomes research and ideally make it a little more accessible for your listeners and anyone else. Health economics, in very simple terms, is a branch of economics where we use economic models and economic techniques, things like cost-benefit analysis, cost-effectiveness analysis, to evaluate the efficacy of a particular health intervention. That could be a medical device, it could be a new drug or pharmaceutical product, but fundamentally, we're bringing economics to bear on the upfront evaluation of that intervention. Outcomes research really brings the patient or the person to the fore in terms of their actual experience with that intervention. Did it work as the clinical trial suspected it would work? Did they have any side effects? What was their experience? And are they actually feeling better as a result of using that device or that drug or whatever it might be. So the combination of those two, health economics on the one side, outcomes research on the other, can be incredibly powerful in terms of informing health policy. And that's fundamentally what ISPOR is all about. We want to understand what is the current state within a particular healthcare system and how a more deeply embedded commitment to health economics and outcomes research can make decision making better. So we want to have outstanding scientific evidence on the one hand, but crucially bring that evidence to bear on actual decision making so that we're getting better health policy that should lead to better outcomes and experiences for more people.
Boy, that's really interesting because so many other professional societies in healthcare almost are limited to the doctors, the nurses, and the researchers. But like you said, you've got a big tent that includes the policymakers so that your members are really part of the discussion and the decision making about, I guess, what we're covering in our health plans and how we're choosing to spend our health dollars.
Absolutely. And just for context, because we're a big tent, alongside some of the stakeholders I've already mentioned, we have, health technology assessment agency representatives. We have payers, we have increasingly investors that are disrupting the healthcare system. And for our membership, I think this becomes an incredibly important value proposition because they're able to engage directly with the widest range of individuals and organizations that increasingly are shaping the healthcare system. And they have an opportunity to make their voice heard. So this is, to me, one of the fundamental objectives of ISPOR is to periodically take the pulse, or maybe a better way of putting it is to say we take the pulse of healthcare systems on an ongoing basis with a view to making health and healthcare decision-making better. And the only way we can ultimately do that is to bring the right people together for very open, transparent conversations about what are the pain points? How do we actually address this? And what is the role that health economics and outcomes research can play in improving health policy?
Well, we got a lot to talk about when it comes to ISPOR, but first, I want to turn to your journey. So how did you get to become CEO of ISPOR?
Well, firstly, I want to say that I love what I do, and I almost pinch myself every day that I have the privilege of leading this organization because I feel, firstly, that it's an organization that matters. And I feel as though I'm blessed with a very engaged and committed board of directors, an extraordinary staff, and a global membership that inspires me. But how did I get here? I would say the unifying theme for, my work, both academically and professionally, has been a desire to improve human welfare globally. So I spent a significant part of my early career working in the corporate social responsibility and sustainability space. So I'm intimately familiar with the UN's Sustainable Development Goals that actually have a lot to say ultimately about health and healthcare decision making. But I worked around the world with many organizations, some of which your listeners would be familiar with. So I helped create some of the sustainability and CSR strategies for the likes of Starbucks, Walmart, and others. But I also have had this lifelong interest in healthcare for many reasons. I lost both of my parents to cancer when I was still quite young. I've realized that ultimately all of us are going to be patients at some point in our lives. And the healthcare system is also a tremendous consumer, if I can put it this way, of budgets in virtually every state, province, territory, and so on. And figuring out how to make people healthy and keep them healthy, and then treat them when they do become sick in the most effective and efficient way has just been a fascinating puzzle for me most of my life. So along the way, I've served on several boards dedicated to health and healthcare decision-making. I had the opportunity to become the chief executive officer for one of Canada's networks of centers of excellence that was focused on gene-based medicine. so the Canadian Genetic Diseases Network and the Canadian Gene Cure Foundation. I also had the privilege of serving as the Chief Executive Officer for Health Technology Assessment International, which really is the leading global society focused on health technology assessment. And all of that was really a stepping stone or a series of stepping stones for the role that I currently have with ISPOR. This is an opportunity to, in many respects, bring everything that I've done historically, both from a corporate social responsibility perspective, but also from a health and healthcare decision-making perspective, to bear on, okay, where are we now? And can we envision a world where healthcare for everyone is actually accessible? It's available when they need it. It's effective in providing the care people need. It's efficient in its use of public money, and it's affordable for everyone. And that to me is a vision and an aspiration that I find incredibly exciting. And that's why I'm here.
Well, Rob, it sounds like you're uniquely qualified to lead ISPOR, but it is different working in these corporate environments and now leading an association where you've got a board and you're working with this big tent with lots of stakeholders. So how did you find the association space, and what's it like running ISPOR these days? How's it different?
I come back to the comment I made a moment ago about the board of ISPOR, the staff of ISPOR, and the members. So to skip to the bottom of the page, it's an incredibly energizing experience for me as CEO. And I find that I learn so much from our members, and I'm grateful to the members. If I step back and look at the experience, I would say from an association perspective, ISPOR is genuinely blessed with its board of directors. I've said this several times in various contexts, and I genuinely mean it. The ISPOR board, it's a volunteer board, and the caliber of people that have stepped forward to serve on the board is extraordinary in many respects. Obviously, there's a level of technical mastery that is impressive, to say the least. But beyond that, there's a geographic diversity to the board so that it's not top heavy with any one particular part of the world. And as a result, there's this internationalist perspective, if you will, that comes through in the discussions that we have that I think ultimately is in service of our members, because we are a global society. And I think that just understanding that we're not a for-profit corporation. We are a professional society. We're an association of members. And one of the things that I've wanted to do in my 2 years as CEO is, on the one hand, do my initial size up of the organization and get a sense as to, how it actually works and what it is like to be in the association space. But at the same time, there's been a real desire on my part to think through, what is it that we can do that is genuinely going to add value to the members? And as I start to engage with my staff and have that conversation, what I've noticed is that they too get really excited about this, because there's an awareness that, yeah, we're shaping health policy. At the same time, we're hopefully creating a set of conditions in which our members and their organizations can thrive as well.
Yeah.
And so, it's been a wonderful learning experience on the one hand for me, but it also feels to me as though ISPOR, and we're celebrating our 30th anniversary as an association in 2025. So I'm really genuinely standing on the shoulders of all the great leaders and others that have come before me. But I feel as though we're at an inflection point. And what we're poised to do, both in the context of serving our members, but also in the context of shaping health policy, is potentially really quite extraordinary. I feel as though we're just, it's kind of funny to think about this, but after, nearly 30 years, I feel as though we're really starting to hit our stride, and we're in a position to say, okay, you know us as this association that's been curating wonderful science, and we're going to keep doing that. But now we're taking that science and we're bringing that with very clear intention to policymakers worldwide, because we actually want that science to better inform health policy. And I find that enormously exciting.
Well, Rob, that is an amazing segue into talking about ISPOR. But before we do that, I want to talk about the rebrand. Because I've been working with ISPOR for many years now. And when I first started working with ISPOR, you were the International Society for Pharmacoeconomics and Outcomes Research. And let me tell you, it took me a year to be able to say that off the top of my head. And now you're just ISPOR. Why the rebrand? What does it represent?
If I'm going to unpack that, Joanna, I would say a couple of things. So it's no secret that ISPOR is the acronym for the International Society for Pharmacoeconomics and Outcomes Research. But firstly, that is one heck of a mouthful.
Yes.
The other thing is that, and I say this with great respect for all pharmacoeconomists out there, but there was this inadvertent feeling that the moment people started saying International Society for Pharmacoeconomics, they kind of blanked out. It was like, oh my goodness, if I don't have a PhD
Right.
in this domain, how do I possibly understand or engage with this? Whereas the Professional Society for Health Economics and Outcomes Research, there's a couple of things here that I think matter. Firstly, it's a professional society, and we're signaling through the rebrand that this is a professional society. We are dedicated to advancing the profession, but not only advancing the profession in terms of its methods, but advancing the profession in terms of its impact. The other thing is that we want to shine a light on the two sides of the equation, health economics and outcomes research, because it's the combination of those two things that I think is especially powerful.
Ah, okay.
And in fairness, I think for most of its history, ISPOR's focus on pharmacoeconomics really betrayed that interest in the methods. And the methods do matter, and we haven't abandoned our interest in the methods. But the rebrand is about saying, we're going to continue curating the methods, but the outcomes research explicitly signals that we're also thinking about the patient experience and patient centricity, and we're thinking about policy and the policy relevance and use of this great science. So the rebrand is still a work in progress in the sense that it's relatively new. We continue to gather feedback from the members and other stakeholders. I think by and large, it's been really successful in terms of making ISPOR as a professional society more relatable and more accessible to more people. And ultimately, one of the things that I want to do, and I know that my staff team as a whole, especially my staff team dedicated to membership, we want to grow the membership. And we want to signal to folks, especially folks that haven't been part of ISPOR historically, you're very welcome here.
Yeah.
Like, we need that diversity of voices and that diversity of opinion to sharpen our thinking and shape the way in which we engage, especially with health policymakers.
Well, Rob, this rebrand is accompanied by a new strategic plan, your 2030 strategic plan, and a new vision. So tell us about this vision.
I want to start with a very short anecdote because I arrived at ISPOR in March of 2023. So ISPOR, like so many other societies and other organizations around the world, was, emerging from the pandemic. And I was on a phone call with the president and the president-elect. And they were letting me know that typically ISPOR has a summer board retreat. But they said, Rob, look, you've just arrived. The summer's not too many months away. Do you want to have a retreat this year? Or do you want to take some time to kind of ease into the role? And I basically said the equivalent of, hell yeah, I think we need a retreat.
Absolutely.
Because this is an opportunity to really dig into our strategic thinking. And that really initiated a process that has culminated in our 2030 strategy. And I'm so excited about this because it symbolically and practically represents a shift. It's like, for most of our history, our vision was to become a professional society. Well, mission accomplished. We did that. Now it's time to really shine a light on the health centricity that is at the heart of ISPOR. So the new vision, and I've alluded to this already in our conversation, is a world where healthcare is accessible, effective, efficient, and affordable for all. So that is this audacious vision. And we're under no illusions. That's not the kind of vision that you achieve in the next fiscal year, but it becomes this North Star. And everything we do, we're kind of measuring it against that vision and asking ourselves, okay, does this take us, closer to that vision, or does it inadvertently pull us off track? And in service of that vision, we've tweaked our longstanding mission just a little bit so that we're basically saying we're going to be proactive. We have to be proactive in light of that vision. And so we are advancing health economics and outcomes research excellence. We're not simply promoting it, which was our historic mission. This is about advancing it and stepping onto the frontier of the scientific discipline on the one hand, but equally stepping onto the frontier from a policy perspective and saying, okay, drug price negotiating has been a hot topic in the United States.
Right.
How does ISPOR feel about that? What's our position on that? That's reflective of the kind of activity that ISPOR increasingly is engaging in. In Europe, the HTA regulation is a groundbreaking public policy development accompanied by things like joint clinical assessment and so forth. Again, ISPOR is engaging actively in that.
And Rob, those are things that you would not have engaged in previously?
I think it's fair to say that there would have been some engagement, but not necessarily in the strategic and coordinated way that we are now. And I'll give you an example of what I mean by that, because the previous strategic plan for ISPOR, and again, I say this with great respect, it was attempting to be many things to many people. There were many, many objectives. And we've been really quite clear in the new strategy. We've said, look, there are two big goals that are in service of the vision and the mission. And one of the goals speaks to our history and our legacy. And that's a goal about leading the definition, measurement, and use of value for health and healthcare decision-making. And the second big goal, I'll come back and provide a little bit of additional commentary if I may, but the second goal is to be the trusted HEOR authority that is leading change in health policy worldwide. Both of those statements, both of those goals are, again, very big, very bold. In the vernacular of Jim Collins, they would be seen as big, hairy, audacious goals.
Absolutely, right.
If we can achieve those goals in the next 5 years, I'll be thrilled and delighted. I expect it to take 10 years. But that's the point. It's like these are animating things that energize the entire organization. And so I think it's fair to say that historically, ISPOR was maybe spread a little wider and not quite as deep as we are now. Now we're basically marshaling our resources and we're communicating with our members and we're saying, hey, do you want to be part of this conversation about leading the definition, measurement, and use of value in health decision-making? And I think most of our members are going, yeah, that sounds pretty exciting. How do you feel about being part of a society that's going to be the trusted HEOR authority leading change in health policy worldwide? Yeah. So, it just provides this organizing frame within which we communicate with our members, but we communicate externally as well, so that someone can ask me, well, when you talk about value and defining that, isn't that something ISPOR has done a lot of already? And I would say yes. And the way in which we've thought about value, and again, as an economist, I have to acknowledge that we've done this, but we've thought about value in a really quite narrow way. And what we've been learning, largely from interactions with patient groups and others, is that the things that make a difference for patients have a lot to do with access to housing, access to nutritious food, social networks, and so forth. And these are things that recently they've kind of been lumped together under something called the social determinants of health.
Right, right.
But from a definition and measurement perspective, they've kind of been off to the side a little bit. So we want to really bring those more centrally into focus. And that's why we're saying that if we're going to lead the definition, measurement, and use of value, we need to redefine the definition of value to explicitly reference things like whole health. And we need to, from a methods perspective, identify, create, and advance approaches, new approaches to improve the measurement of value and the use of value. And part of that, by the way, means that we have to be thinking in ways we haven't historically about driving the integration of affordability, accessibility, and equity in decision making. So there's this very exciting portfolio that's all about defining value, measuring value, and crucially ensuring that that is used for health and healthcare decision making. And then on the other side, from an aspiration about being the trusted HEOR authority, and this is new territory. This is genuinely new territory for ISPOR. We're actively engaged now in the process of horizon scanning on a global basis to identify high leverage health policy opportunities where ISPOR should intervene because we believe we can make a difference. We're establishing and communicating in ways we haven't historically ISPOR best practices. I mean, we have a legacy of convening and running task forces, for instance, that really define the good practices in HEOR. And not long after I arrived as CEO, I had the opportunity to talk with a number of the chairs of various task forces. And I would say, gosh, this is an incredible report. What happened with it? Did we actually have a press conference? Did we go to Washington? Did we produce a plain language summary for the government decision maker who probably won't read the peer-reviewed article and so forth? And we didn't do any of those things for the most part.
But that's because you were an association for the members.
We were maybe a little too inwardly focused. Yes, that could be said. But I think as well, part of it is the evolution of the profession. It was necessary for us to be inwardly focused and really spend that time developing the methods and really advancing the science, quote unquote, if you will, of HEOR. We're at a point now where we have this stockpile of incredible scientific evidence, and it hasn't been used or used as much as it might be. And of course, we're actively stepping onto that new scientific frontier and creating new scientific evidence. And for me, there's just a desire to say the metaphorical finish line for our profession has moved. We still need to be, and we always will be, a scientific society. But the science alone is not going to get us where we need and want to be. We need to package that science, communicate it in a compelling way, and make it understandable and relatable to the person that's actually making a decision. And that's the great opportunity now. And that's why we're wanting more and different stakeholders to join us on this journey. It's why we welcome anyone into our tent to have conversations about this, because all of us have skin in this game. Health policy, on the one hand, for some, it can seem a bit abstract, but ultimately it's like, no. Like when you have a conversation with your doctor about a particular prescription, is there a conversation about whether you can afford that particular option? Is there a conversation about side effects, et cetera, et cetera? All of us in various ways are either actively engaged with the health system currently, or we know someone who is. And so for me, there's just this sense of how do we make it better? What can we dare to imagine, and how can we make it better? And that's what ISPOR is all about right now.
Well, Rob, this is a seismic shift, right? I mean, most associations will say things like, we want to be the place where the industry gathers, where people can find resources. You're actually articulating a vision and saying, be part of the community of experts that are going to make this vision happen. And that's very, very different. You're launching something new in 2025 that I think is pretty integral to this new mission, and it's your Institute for Global Health. So what's that going to do, and how will that further your mission?
I'm really glad you brought this up, because this is something of which I'm really excited. In very simple terms, I have a tremendous in-house science and health policy team, and it's fair to say that they are pretty much tapped out curating the scientific content for our conferences and summits, overseeing the task forces and special interest groups and webinars and all of the various things that we do with our current members. Fantastic stuff. And I've been asking this question over the last couple of years. What lies around the metaphorical corner? Like, what if ISPOR could start to say, okay, what are the issues that are going to be shaping health economics and outcomes research in 3 years' time or 5 years' time? And how will that in turn potentially have an impact on health policy? And that's really the genesis for the ISPOR Institute for Global Health. This will be a division of ISPOR, but it will be liberated from the day-to-day necessity of what's happening in a few months' time. Instead, it has the opportunity to say, what is happening in 3 years' time or 5 years' time? What are the questions that, if answered, will really have an impact, not only on the profession of health economics and outcomes research, but ultimately health policy? And I'm glad you made reference as well to the notion of community, because the ISPOR Institute, and it's still something that we're moving forward from. This was a great idea, and now it's becoming real. And 2025, we'll see lots of initial progress. But this is not something where we're going to act the drama as if we're all alone. We want to be working with partners. We want to be drawing other members of the quote unquote health community into the conversation so that, we'll be assembling a really diverse advisory board. We'll be identifying projects that are in our wheelhouse, so to speak, because we don't need to reinvent the wheel. We don't want to create an institute that is seen to be competitive with someone else. Instead, we want to basically be saying, what are the gaps in health economics and outcomes research that could be filled and need to be filled? How can we respond to some of the questions that are being asked about the efficacy of health economics and outcomes research? So this is about creating something that's complementary to everything else ISPOR does and enabling what I would hope is ultimately a quantum shift in the understanding, the use, the relevance, and the impact of HEOR globally.
Well, Rob, you talked about working with partners. So are you working with other organizations? And what about your chapters? Like, how do they fit into all this? How are you activating them?
Yeah, fantastic question. I'll start with the chapters and then move outward from there, because the chapters are near and dear to my heart. So we have a network of 90 plus chapters across the world. And that again speaks to the fact that we're active in over 100 countries. So I have a small but mighty global member engagement team. And over the last 2 years, we've been very deliberately reaching out to the leadership of those chapters in some respects to say, look, the past is never just the past, it's context. And we may not have engaged with the chapters historically in quite the way or ways that we need to now. So I'm committed to changing that. And in particular, I'm really committed to growing my own and my team's understanding of local conditions across the globe. And that's where the chapters are invaluable, because they're embedded in a very particular cultural, economic, and social context. So bringing the chapters a little more closely into the fold and making them feel as though they're seen, heard, and understood and part of this wonderful and exciting vision that I've shared. That's a critical piece of this if we're going to be successful. At the same time, we've spent a good deal of time over the last year in particular building what I believe is ISPOR's first ever stakeholder map. And in very simple terms, from the universe of organizations, people, and so on with whom we might engage, what are the organizations that have the highest impact and highest influence on health economics and outcomes research and health policy? And so as a result, we've really begun to thoughtfully engage with other professional societies, but equally, we've begun to engage with the FDA in the United States and the European Medicines Agency in Europe and the fledgling African Medicines Agency, because we want to be at the metaphorical table where decisions are made.
Right.
And so This is about conveying this seismic shift, as you describe it, to our members so that they understand that, yeah, ISPOR is actually flexing its muscles a little bit and is starting to say, hey, we know that healthcare decision making is incredibly complex. We know that health systems across the globe are struggling in the face of complexity and affordability and so forth. We don't pretend that we have a silver bullet, but we do think that health economics and outcomes research is one of the best kept secrets in global healthcare. And that if more people understood it and used it, and we were actively engaged in a conversation about value and how we think about and measure value, and bring that understanding into discussions about health policy, we're going to get a better outcome. We're going to get a health system that is accessible and effective and efficient and affordable. And I think our members are responding to that. And they're kind of saying, yeah, we should be doing that. And so that's the sort of thing that gets me out of bed every morning and makes me excited to do this work.
Well, I'm excited to do this work. I've been working with ISPOR for how many years now? I've always been really proud of the work, and now I'm fired up.
Good.
I got another question for you. So, you opened this podcast interview by talking about how ISPOR traditionally held a lot of value for members through its conferences. And now you've really expanded the thinking, and you're really the leader in articulating this vision for what healthcare can be and should be for everyone around the world. So what's happening to the conferences?
The conferences are, I hesitate to say getting bigger and better, but the reality is that the conferences are getting bigger and better. But there's a few things to say here. I think it's a testament to our members that my first conference as CEO was Boston in 2023, which at the time, I believe, was a record-breaking conference for North America.
Congratulations. Yeah.
Later that same year, we had our European conference in Copenhagen, and it set a new all-time record. A few months ago in Barcelona, we actually surpassed that record. So the members have been turning out in droves for our two well-established conferences. And it's not just about making the conferences bigger, quote unquote. I think it's about developing the conferences. And I don't mean to sound cute in making that distinction, but I think it's an important distinction because for me, the size of the conference is less important than whether the conference is really adding value
100%.
to our members on the one hand and contributing to the conversation about health policy. So a couple things. The international conference, which is held annually in North America, and the European conference, those are the flagships. And those are going to continue, and those are going to hopefully get better and better and offer more value to members. And I'm super excited to share this, 2025 will see our in-person return to the Asia Pacific region. We'll be convening a real-world evidence summit in Tokyo later this year. And I'm genuinely excited about that for the event that it will be. But even more importantly, it is the first step in a return to the Asia Pacific region. For me, it's never about having a single data point. It's actually about painting a picture. And for me, this is the first step towards what will likely be a conference in the Asia Pacific region. And it will also be part of a larger Asia strategy. So there's very specific opportunities and needs in India, in mainland China, in the rest of Asia. And I really want to be engaging with our chapters and our members in those regions to shape what the next 5 years can look like. But the two big conferences are going to stay and get better, and we'll be adding to that portfolio in Asia. We'll also be adding to that portfolio in Latin America. We've been, I will say, very, very fortunate that some of our chapters in Latin America are among the most active and progressive across the globe. So we've been able to co-create and co-host a number of chapter events with our Latin America partners. And that too is a step towards a larger summit and ultimately a conference and other value adding activities. And maybe this is worth saying and sharing. I have no predisposed idea that we have to have a conference or a webinar or a whatever. For me, there's a sense of we've got some ideas that we want to bring to the table, but I want to engage with our members. I want to engage with our chapters to co-create something that really reflects that local context and local desire. I happen to think that a conference in Latin America would be successful, especially if it was one in which we gave our chapters and members there more agency. But ultimately, we're going to work collaboratively. But the bigger picture here is that the two conferences will remain, and we're developing around those and creating more opportunities for current members to engage, and hopefully creating the conditions in which people that aren't yet members of ISPOR see value and want to become members.
Rob, I'm fired up by the vision. I am so happy to have had the chance to interview you today. I hope that you will come back next year because you've got to tell us about all the things that you have laid out for us in 2025. And I can't wait to hear how you've advanced in meeting the vision.
I would welcome the opportunity to return in a year's time and give you an update, Joanna. I really, really would.
Thanks for listening to Associations Thrive. We're so glad to have you here. You know, my personal mission and the mission of my company, Matrix Group International, is to help associations and nonprofits increase membership, generate revenue, and thrive in the digital space. I want to hear stories of how your organization is thriving in today's challenging landscape. Please apply to be on my show by going to podcast.matrixgroup.net. By the way, do you need help with a digital initiative? Maybe it's a website redesign, a new membership database, or a hybrid meeting that you're planning. I'd love to connect with you. Please visit the Matrix Group website at matrixgroup.net. Thanks again for listening to this week's episode of Associations Thrive. Don't forget to subscribe to the show, leave a 5-star rating, post a comment, and share it with your colleagues and friends. Bye!